I'm Professor Jonathan Barratt. I'm a professor of renal medicine at the University of Leicester in the UK and a practicing nephrologist in Leicester at the University Hospital in Leicester. I have a career-long interest in glomerular disease, particularly IgA nephropathy, and I run a basic science laboratory where we look at the basic underlying mechanisms of the disease, but I also run clinical trials of new therapies in patients with IgA nephropathy. So really look at this disease from the bench all the way through to the bedside. Yeah, so IgA nephropathy is a disease of the kidneys. It's a disease of the fine filters of the kidneys. And it's a disease that we commonly see presenting in young adults. So adults in their 20s and 30s will present with abnormalities in their urine, perhaps abnormal blood tests, high blood pressure, and we will diagnose the disease with a kidney biopsy, and we will then want to be able to manage and try and reduce that degree of inflammation in those filters. We're only born with a certain number of filters in each kidney, and once they're gone, they're gone. We can't replace them. And the real worry for these young people who are diagnosed with IgA nephropathy is that risk of developing kidney failure. And that's a really difficult thing for people to deal with, because we know that there are certain features that increase the risk of developing kidney failure. And of course, if you're diagnosed with this disease in the 20s, we're thinking about trying to preserve that kidney function for the next 50 years. And at the moment, we really don't have very good treatments to do that. But that's changing. And there's some very exciting news on the horizon.